And so our first speaker is going to be Shannon Monnat from Syracuse University's Maxwell School of Citizenship and Public Affairs. And she's going to be presenting on the pilot project she's been working on rural and urban differences and COVID-19 impacts on working age adult psychological well-being and substance use. With that, I will turn it over to you, Shannon.
Thanks, John. And thank you to the SBE CCC for funding this pilot grant. I'm going to provide an overview of the National Wellbeing Survey, which you heard me talk a little bit about earlier. Sorry, it's me again. You heard from me earlier to hear from me again. Talk about the NWS and its utility for understanding geographic differences, not only in COVID-19 impacts, but for various other physical, mental, and psychological well-being outcomes. We use the pilot grant funding entirely to increase the sample size of the National Wellbeing Survey. So as part of we collected the first wave of these data before we even knew this UO1 thing existed. I really wanted a National Wellbeing Survey data set that collected a comprehensive set of what I call psychosocial well-being measures, and that was geocoded, and that oversampled rural working age adults. So that was the kind of impetus for this survey originally. When COVID hit, I mentioned earlier, we delayed longer. And then I said, heck with it, we just need to add a COVID module and get on with this thing so we can at least control for COVID impacts and the other analysis we really want to run. And it turns out that having done that survey actually gave us an edge with the UO1 competition. And so we leveraged that to collect 4 additional waves of these data for the first 4 years of the UO1. But the budget is what it is, and the sample size was going to be smaller than it was, and we took advantage of this pilot for year 2 and just collected a larger sample size with a larger rural population. So again, this is the whole UO1 team. It's the same group that's working on this pilot project. The aims of this pilot project are to, as I said, enhance the utility of the NWS to be able to identify and understand rural-urban differences in COVID-19 impacts, although because we're collecting a larger sample and we have a robust sample of rural working age adults, really it's enhancing the utility to do geographic analysis more generally on a wide variety of various outcomes that I'm going to talk about in a minute. And then a secondary aim of this pilot is to identify rural-urban differences in COVID-19 impacts on psychological health and substance use in 2022. So we're going to use this year's data, which we just collected hot off the presses. Qualtrics actually just sent me the data set while we were in this meeting. So yay. We're gonna use that to look at perceived COVID-19 impacts on psychological well-being and substance use about 2 years after COVID began, and how those differences may be associated with different state policies, local COVID severity, and economic conditions, and various individual level factors. So the National Wellbeing Survey is a national cross-sectional survey. So we don't have panel data here. These are repeated cross-sections. Geocoded, we have state and county FIPS codes, which makes this very exciting for linking contextual data. It's a survey of adults ages 18 to 64. It's administered through Qualtrics Panels. The first wave was administered in February and March of 2021. We collected the second wave starting around mid-May to just 2 days ago, as I mentioned, just got the data. So we pretty much doubled the sample size from the first wave to the second wave, thanks to the pilot grant funding. And to create a demographically representative sample of this working age group based on age and sex and race ethnicity, we sent quotas to Qualtrics based on the ACS, the 2015 to 19 ACS, on each of those demographic characteristics. And so Qualtrics targets populations that are more difficult to reach for online surveys first. And then as quotas for those populations are reached, they shift their recruitment a bit to get easier to reach populations. We did originally oversample rural adults, which I'll show you in a minute for our wave 1 data. But we wanted to have an even larger sample size here in wave 2. So the NWS includes various indicators of physical health, mental health, behavioral health. We've got pain on there, health behaviors, participation in social activities. We have a battery of questions on how COVID-19 has affected respondents' lives. We have standard demographic and socioeconomic questions. And the really exciting thing are the state and county FIPS codes, which will enable researchers to merge these individual level data with contextual data. And just to give you a flavor of kind of the counties that are covered, for wave one, I haven't had a chance to look at the final wave two yet, but for wave one, about 1,400 US counties are represented in these data, and we've compared them to US counties overall, and they are demographically representative of US counties overall. We added several new topics for wave two to capture issues that have emerged since we put together our UO1 proposal. In our UO1, we said, oh, we'll work with the SBE CCC, we'll work with NIDA, we'll see what new issues are emerging, and we'll build our follow-up surveys from that. So we've added, we talked about long COVID earlier, we've added some questions about lingering health effects from having COVID. We've added questions about vaccination status and reasons for not getting vaccinated, questions about changes in living situations, employment situations, new diagnoses for chronic health conditions that weren't diagnosed before COVID, changes in mental health and substance use disorder diagnoses, changes in alcohol consumption, illicit and prescription drug use, changes in people's perception of their overdose risk, and then healthcare system treatment delays, including delays to substance use treatment. So as I mentioned earlier, respondents are sampled from Qualtrics Panels. This is an online survey platform. They maintain a database of several million US adults who volunteer to participate in surveys. So this is a somewhat selected group. Qualtrics panel members' names and addresses and dates of birth are typically validated via third-party verification. And so panel members get this email invitation with a link to the survey. And then they fill out the survey, and Qualtrics compensates them in various ways, like airline miles and gift cards, depending on what they agreed to when they joined the panel. Then Qualtrics does these extensive data quality checks, and they purge respondents who are identified as straight liners, speeders, being inattentive, or they're otherwise low quality. But our research team, sets even more stringent standards and conducts additional checks for straight lining on specific items, for item mismatch, for example. So like if someone identified that they were 18 years old, but they also said they served in the Vietnam War, they get bumped, right? So I did about 9 data checks over the course of this last round, our wave 2, and then Qualtrics would just purge people who I said, no, we don't want them. And they would go back to the pool and make sure we get quality surveys. Qualtrics also provides a post-stratification weight, which is especially important because we're oversampling rural residents, right? So we need to weight our analysis to account for the fact that we have a larger share of rural residents than are represented in the US population. And so when weighted, the NWS is representative of the 18 to 64-year-old population based on sex, age, race, ethnicity, educational attainment, marital status, presence of children in the household, and rural-urban continuum. We've done some comparisons to other surveys, and we found that prevalence rates on several health conditions and COVID-19 items are comparable to other national surveys like the NHIS, for example, National Survey on Drug Use and Health, the Urban Institute, American Family Survey, and others. So to give you a sense of the rural oversample in wave 1, these are the data we collected in 2021. This shows the 9-category rural-urban continuum codes. These are based on the USDA Economic Research Service classification scheme. The first column with the percentages shows the share of adults 18 to 64 that live in each category. The second shows you our target sample size in wave 1 for each category based on our sample size of 4,000. And the final shows the final sample that was achieved. And you can just see here that whereas nationally, non-metro residents represent about 13.6% of the 18 to 64 pop, they represent about 28% of our non-metro sample. And we have a decent non-metro sample size even in wave 1 of just over 1,100. But in wave 2, things get even better. So here's the same information for wave 2. Again, we're oversampling. The data that we just got shows about 26.6% of our sample is non-metro. We've got about 2,100 non-metro residents. So we pool these two surveys together, we've got a combined non-metro sample size of about 3,300, which power analysis suggests, is well over what we need to have robust rural-urban analysis, and even some within rural analysis. So we have 4 publications out so far from the Wave 1 data, and not all of these are directly related to the UO1, but we have 3 on COVID-19 impacts and 1 on basic rural-urban differences in self-rated health. So we've demonstrated we can find statistical significance even with those Wave 1 data. Really excited to dig into the Wave 2. Really quickly, I don't have anything to share from Wave 2, but I do have some things I can show you from the Wave 1 data on metro status differences in COVID-19 impacts. So this just shows non-metro residents compared to metro residents on a number of outcomes related to COVID-19 experiences. These are standard binary logistic regression models. Standard errors are clustered at the state level. These models control for a basic set of demographic covariates listed up there. The yellow highlighted variables are outcomes for which non-metro residents have had significantly greater odds. So non-metro residents were more likely than metro residents to report testing positive for COVID, living with someone who tested positive, having a close friend or family member test positive, having a close family member hospitalized, quarantining, seeking treatment for anxiety or depression due to COVID. And then there were also differences on a handful of economic and employment outcomes. So non-metro residents had significantly greater odds of being late paying rent or mortgage and other bills, reporting they couldn't afford groceries or other necessities, getting a loan from family or friends. Non-metro residents had lower odds, though, of working remotely. So that just gives you some flavor of some of the COVID-19 variables that are available in the survey and some of the effect sizes. And even though these error bars are pretty wide in some cases, you can see that even with that smaller Wave 1 sample, we have large enough sample size to identify some significant differences. So wrapping up, our next steps are right now we are in the process, fabulous postdoc who's on this meeting today, in the process of preparing all of the Wave 1 material for public sharing, hopefully through ICPSR. We're working with Megan to make that happen. We'll have both a public use and a restricted use version of the data. The restricted use version will have the geographic identifiers, the public use version will not. In terms of Wave 2, we're going to clean these data we just got and prepare them for analysis and begin considering these geographic differences in different COVID impacts. And then immediately after that, begin the same process for getting those materials ready for data sharing. Thank you so much for listening and look forward to questions.